Welcome to the recorded version of the Grantmakers in Aging web seminar, Why the Affordable Care Act Matters to Diverse Older People, featuring Yanira Cruz, President and CEO of the National Hispanic Council on Aging, Michael Adams, Executive Director of Services and Advocacy for LGBT Elders, and John Feather, CEO of Grantmakers in Aging, from November 6, 2013. This event was made possible by a partnership between Grantmakers in Aging, the John A. Hartford Foundation, and the California Wellness Foundation. Technical and production support is provided by the American Society on Aging.
Thanks, Steve, and thanks to all of you who have joined us today for this very important and timely topic. Before I begin, we want to thank two of our members for their support in making today's webinar available. The John A. Hartford Foundation of New York provides continuing support for the webinar series, and today's webinar is being co-sponsored by the California Wellness Foundation. We also want to thank the expert team at the American Society on Aging for providing technical and production support for the series. The number of uninsured older adults 50 to 64 continues to rise, from 3.7 million in 2000 to 8.9 million in 2010. In addition, people of color make up more than half of the uninsured in the United States. And research shows that people of color across the age span face significant disparities in physical and mental health. Additionally, many people of color delay care because of potential medical costs and out of fear of discrimination or cultural incompetence from medical providers. These issues are especially true for LGBT people of color who face challenges on multiple aspects of their identities. The Affordable Care Act, or Obamacare as it's sometimes called, has the ability to create a path to better health by offering more affordable health insurance options, improving services, and eliminating the usual obstacles. Today we will discuss both national and state-specific examples on what is being done to ensure that older people know about the changes that are taking place under the ACA and how it affects them. We're very pleased to have two of our nation's best experts to help guide us through this discussion. Dr. Yanira Cruz is the President and CEO of the National Hispanic Council on Aging in Washington, D.C., and Michael Adams is the Executive Director of Services and Advocacy for LGBT Elders, or SAGE, based in New York. Together, they're here on behalf of the Diverse Elders Coalition, about which you'll hear a good deal more in just a moment. So welcome to you both. Thank you. If we can move to the next slide. Yanira, let's start with you. What are our goals today for this presentation?
Thank you, John, for having both Michael and I today. And on behalf of SAGE, the National Hispanic Council on Aging, and the Diverse Elders Coalition at large, we're delighted to be here. And so today we want to illustrate why the Affordable Care Act matters to our communities as racially and ethnically diverse people, American Indians and Alaska Natives and LGBT older people. But we also look forward to answering any questions after our presentation. And specifically, today we'd like to focus on the Affordable Care Act, the opportunities, the challenges, and some lessons learned. We will also share some examples of our work. Thank you, John.
Michael, let's turn to you as we move to the next slide.
Is growing its social media presence. So you can follow us on Facebook at facebook.com/diverseelders and on Twitter at diverseelders. Additionally, you can visit us on the web at diverseelders.org. And for today, you can join the conversation on Twitter and Facebook by using the hashtag DECChat. And the Diverse Elders Coalition and our member organizations are live tweeting right now during the webinar.
That's great to see. And as we get started, tell us a little bit about yourselves and your background. Yanira, let's start with you on the next slide.
Sure. So I have the great honor of serving as President and CEO for the National Hispanic Council on Aging. I'm also a co-founder, along with Michael and my other colleagues, of the Diverse Elders Coalition. I hold a doctorate in public health, and I also believe that access to health care is a human right. Our collective efforts started back in New York several years ago. Michael invited us to present at his conference, representatives from our national organizations serving diverse elders were part of that panel. And during that panel, one of the common themes that emerged was the lack of access to services, the notion that we share similar challenges, and the recognition that we can collectively accomplish greater impact was loud and clear for us. And so the need to organize at a national level and come together as a collective was born. That theme continues to be a common denominator for the Diverse Elders Coalition today.
Thanks. Michael, why don't you tell us a little bit about yourself as well, and then also, as we move to the next slide, a little bit more about who's involved in the Diverse Elders Coalition.
Sure. I have served as SAGE's executive director since 2006. SAGE is the country's oldest and largest LGBT aging organization, and we engage in services and advocacy and training on LGBT issues through our headquarters in New York City and offices in Washington, D.C. and Chicago, and also through our 26 affiliates in 19 states across the country. SAGE also runs the federally funded National Resource Center on LGBT Aging, which is a training institute. In talking about who's in the Diverse Elders Coalition, I just would pick up on the points that Dr. Cruz was describing in terms of our conversations over the years. And one of the things that we saw over and over again is the really this common theme about access to services and access to care and significant barriers that are reflected in our diverse elder communities. And so the organizations that are members of the coalition are organizations that have prioritized aging issues in diverse communities and focus on access issues and overcoming barriers. In addition to SAGE and the National Hispanic Council on Aging, the Diverse Elder Coalition members include the National Indian Council on Aging, the National Asian Pacific Center on Aging, and the Southeast Asia Resource Action Center.
Well, great. As we move to the next slide, and we'll continue with you, Michael, we've obviously we're hearing a great deal about the Affordable Care Act, or Obamacare as it's sometimes called, and it's not a program primarily oriented towards older people. So why is it that ACA matters to older people?
Sure. No, that's a very important question, and one that is important for us to talk about here. And here again, in thinking about the Diverse Elders Coalition, so much of our work focuses on strengthening policies and programs to enhance the health and well-being of diverse elders. And we recognized really early on from the early adoption of the Affordable Care Act that there was going to be a significant and important set of implications for diverse elder communities. So, for example, in fact, one of our coalition's earliest advocacy efforts surrounded the national prevention strategy that was mandated by the Affordable Care Act, and our efforts, fortunately, which were successful in convincing the National Prevention Council to embed specific references to the health disparities that diverse elders experience, to embed references to them and the importance of addressing them within the national prevention strategy. There's a misconception in some circles that the Affordable Care Act does not matter to older people because of Medicare, and that is simply inaccurate. I just want to share a couple of points about that. First of all, the coalition represents some of our most vulnerable older adults, older people of color, LGBT elders, and many of whom are dealing with health disparities, lack of insurance coverage, and related issues in their 50s and early 60s before they're Medicaid eligible. And so this makes the Affordable Care Act in the marketplace very important. The marketplace is going to impact uninsured and underinsured older people who are in the 50 to 64 age range in important ways by making coverage available that would otherwise not be available. And, in addition, there are also some older adults, 65 and up, who will need to rely on the marketplace. For example, the 10 million non-citizens who are living in the United States legally have the opportunity to gain insurance through the marketplace. And this is a very important population because those born outside the United States are, in fact, 2.5 times more likely to be uninsured as those folks who are native born in the U.S. So, I mean, these are some of the reasons why it's been the Affordable Care Act and its equitable implementation has been a focus for the Diverse Elders Coalition.
Let me ask you one quick follow-up question before we move to the next slide, Michael. Explain a little bit more about what the marketplace is.
Sure. Well, the Affordable Care Act is being implemented through exchanges, at the state level all across the country. Some of those exchanges are being administered by the federal government. Some of the exchanges are being administered by the states. This is the playing field on which individuals will be able to enroll in order to receive health insurance coverage through the Affordable Care Act. And, the marketplace is the common terminology we use to describe that system of access that unfortunately has become in the first month somewhat notorious because of some of the glitches with the Affordable Care Act or marketplace website. So that's the reference to the marketplace.
Okay, thanks. I want to remind our audience that we will have a extended period at the end of our presentation for your questions. We need for you to send those questions in writing. You can do that in the box that's on the right hand of your screen. You will see a section there for questions. If you open that up, you can type your questions in now or any point during the presentation, and we'll be getting to those later on. So as we go to the next slide, let's talk a little bit about what you see as the opportunities for ACA for diverse elders, and we can actually go to the next slide after that.
Sure. So when the Affordable Care Act was signed into law, we knew that there was a tremendous opportunity to improve the health of our nation's older adults. And there's a real opportunity to achieve health equity. We know that statistics show us, and in fact, according to the Kaiser Family Foundation, people of color make up more than half of uninsured people in the United States. And, 9 in 10 would qualify for the Affordable Care Act and expansion cover benefits. In addition, the number of older people aged 50 to 64 without insurance continues to increase from 3.7 million in 2000 to 8.9 million in 2010. The other opportunity that we see here is that the law strengthens Medicare. It strengthens Medicare by including more preventive benefits, by lowering the price of prescription drugs in the Part D donut hole, and fighting waste and abuse. We're also delighted that this law funds research about health disparities. And this is an area badly needed across all of our communities. And in this regard, as a collective, we have been very concerned with the limited level of research that has been funded in the past to understand health challenges impacting our communities. The Affordable Care Act also promotes the racial and ethnic diversity of healthcare professionals. And this is good news for our communities, and I think a step in the right direction to achieve health equity. We need more of our community members to become medical doctors, nurses, and public health practitioners and serve our communities. The Affordable Care Act also invests in primary care professionals so more Americans have access to primary care. The law also expands community health programs to help manage chronic conditions such as diabetes. And diabetes has reached epidemic proportions in many of our communities. African Americans, for example, Latinos, American Indians, and Asian and Pacific Islanders have a particularly high risk for type 2 diabetes.
Those are some important opportunities in this new legislation and this new program that's being implemented. As we move to the next slide and to the following one, Michael, could you talk about some of the challenges that we're seeing in implementing the ACA?
Yeah.
Yenira, do you want to start with that?
I'll start with that.
And I'll pick it up.
Okay, I'm sorry.
Yep, no, that's fine. Well, I think...
So why don't I pick it up and I'll pass it back to Yenira in a moment. So, certainly anytime we see, a new program, a law of this complexity being implemented, there are going to be challenges, and the Affordable Care Act is no exception. And obviously, I don't think it's going to be news to anybody who's participating in this webinar that there have been plenty of glitches in the early rollout that have made it harder, really, for anybody to participate and access the system and enrollment in the early days. In addition, I think we clearly need to recognize that the fierce opposition to the Affordable Care Act from some well-organized and well-funded sources and the fear and misinformation that's been spread as a result is a big general challenges. So those are challenges that are challenges to Affordable Care Act implementation in general. But if we think more specifically around the challenges as they relate to diverse elders, there are a couple of things that I would flag. There is, what we know and what we know from our experience in our communities, our diverse elder communities, is that in any kind of a health program, and certainly one of this complexity, there's going to be difficulty in accessing appropriate information and in participation, especially for limited English-speaking elders. There are going to be navigation challenges for limited English-speaking elders. And just as an example, our coalition partner, the National Asian Pacific Center on Aging, or NAPCA, has advised us that historically, and in their work, many AAPI elders rely on in-language media. So we're talking about Asian American and Pacific Islander elders, rely on in-language media, whether it's print, radio, and TV. But this has not been extensively available in the early days of the rollout of an implementation of the Affordable Care Act. So here again, this is an illustration of one of the reasons why the work of the coalition and our members is so important. There is a system of navigators that has been set up for Affordable Care Act implementation. That certainly has been helpful, including helpful to members of our diverse elder communities. But that system has its limits. It itself has been challenged in some ways by some of the opposition to the Affordable Care Act. It's been hampered by difficulties with the rollout, and the system the system of navigation does not effectively and fully cover and reach all diverse elder communities. And then just one other thing I would mention, I don't want to take up too much time with this, is that another challenge to implementation, a successful implementation of the Affordable Care Act, is access to technology and kind of technology knowledge and savvy among our populations. We know that in general, many older people don't have the level of access to technology that we would like. Now, this is changing rapidly. The digital divide is rapidly closing among older people, but it's still very much a reality. And it's even more of a reality for especially vulnerable low-income elders who are elders of color and LGBT elders. So hopefully I'll have the opportunity to talk a little more about this later, but the coalition and its members are working on the ground with our affiliates and partners to address issues like this. And actually, one other thing I would want to mention, as the slide indicates, is transportation is a significant challenge, including an engagement with this, with the marketplace, with the exchanges for older adults, especially those living in rural areas. So, for example, the National Indian Council on Aging has advised us that transportation and the lack of it significantly limits the ability of American Indian and Alaska Native older people to take advantage of navigators. And similarly, the National Hispanic Council on Aging has confirmed similar concerns and challenges among Hispanic older adults. So these are some of the challenges that we're looking at and trying to figure out how to address.
Would you like to add something to that, or shall we move forward to the lessons learned?
We can talk about lessons learned, and I'll just chime in later on.
Okay, so if we move on to the next slide, what are some of the lessons that you're already learning from this implementation process?
Yeah. So since the marketplace opened back in October 1st, we have been working with our member organizations and have been helping grassroots leaders and grass-top leaders understand how to do outreach and assist in the enrollment efforts within our diverse communities. We have also worked closely with our older adults themselves to sign them up for health insurance. And so during this time, we have learned many lessons, such as how important it is to have culturally and linguistically appropriate materials and the important role community groups play. Many of our community members are eager to have health insurance because of recent diagnoses, such as terminal cancer, diabetes, or high blood pressure. We are seeing that there is still a big disconnect with people and the Affordable Care Act. In fact, many people shy away from talking about the health care coverage only because they don't know enough to carry a conversation. Many have been informed with negative aspects about the law, and none have pointed out the positives. And so, for example, in the case of Latinos, they are more reserved to come to us, so we have to go to them. Many of the persons we speak with want to communicate in their language. So, for example, in Spanish in our case, but want information in English to take with them. And so this makes for a more professional experience for the client and for the people that we're serving.
Great.
And so a clear lesson that we have learned is the need for culturally and linguistically appropriate materials and representatives at the local level.
And that's on the next slide. Yes, go ahead.
A number of ACA enrollment resources are currently not culturally and linguistically appropriate. And so in ACOA, we know that rather than providing translations of documents, it's important to have this information made in Spanish and designed for a Spanish-speaking audience. Much of the mainstream consumer information on the Affordable Care Act and the marketplace doesn't take into consideration the needs of LGBT people, especially transgender individuals, much less those who are 50 or older. And so, another lesson that we learn is the importance of media as an outreach tool, and Michael alluded to this a little bit earlier. Mass media can be a huge source of information for many of the older adults we serve. And we see that there's a huge need to develop a mass media campaign, including using ethnic media in order to get to our communities and to ensure that they connect with accurate information around the Affordable Care Act. Another lesson that we learn that we're learning is that community groups are effective, yet don't have enough resources to carry out the work that is needed. So since the passage, misinformation and disinformation about the Affordable Care Act, as you know, have been rampant. And combine that with the fact that Medicare fraud and exploitation has historically been targeted at limited English proficient elders, there's reason for all of us to be concerned about how elders in our communities will be taken advantage of in the flurry of implementation. And so, fortunately, trusted community leaders and community-based organizations can be effective spokespeople and in matters such as the Affordable Care Act. In the absence of these CBOs and trusted messages, we create a vacuum that leaves elders vulnerable to predatory practices.
John, can I add a comment to on this point in terms of lessons learned?
Sure.
I really wanted to underline the last point that Gennaro was making in terms of the role of trusted community groups, because there's a larger context here, and it's a context in which we know, and the work of our respective organizations across the Diverse Elders Coalition, that for a whole variety of historical reasons, many members of our community have a certain distrust of the healthcare system and a certain distrust, in some cases, of service providers. In a variety of different contexts, this has led to avoiding access to care, avoiding access to services. And so that's a general context in which we operate within. then we step within the implementation of the Affordable Care Act, which has been surrounded by a great deal of controversy and a great deal of messaging from folks who are not supportive of the act, indicating that the act is going to lead to a parade of horribles for people who participate in it. And so when you layer that historic distrust onto the circumstances in which the ACA is being rolled out, it really makes, in this particular context, the role of trusted community groups, I would say, almost uniquely important in the sense that it's hard, certainly in our recent history at SAGE, it's hard to remember a time when there was more consternation and more concern and fear, even while our constituents at some level recognize that there's a need to be addressed and a potential opportunity here. So I guess I just wanted to, reiterate the importance of the trusted community representative, navigator, et cetera, in the particular context in which our communities are living and operating.
And especially because we are dealing with sensitive information.
Right.
Confidential information many times.
Absolutely.
So it's a daunting challenge in a short time frame where unfortunately some of the federal leadership has not been up to our expectation. I do want to remind our audience that once again we will be having a question and answer period a little later. You can go ahead and enter your questions in under the question box, which is to the right of your screen. And you can do that at any time, and I will be asking our panelists a little bit later. So as we go to the next slide and start looking at some specific examples, these are all important insights about the general program and so forth. But tell us a little bit more about some of the work of the Diverse Elders Coalition, specifically around how you're starting to address these issues.
Yeah. So one of the things we've done. We are involved in online advocacy and education around the Affordable Care Act. We are developing voices at the grassroots level to educate, reach out, and enroll individuals in the marketplace. And I think that's particularly important given this trust issue that we have to be mindful of in our communities. We're also involved in state-specific advocacy, and we're creating resources for advocates and older adult consumers. And so we share these examples because we believe that these serve as concrete ideas and opportunities of the kind of work that funders can support.
Well, Michael, as we turn to the next slide, then tell us a little bit more about the state-specific advocacy work.
Sure. As Yanira mentioned, the work at the state level is extremely important because this is where implementation hits the ground and leads to enrollment and insurance coverage. So the Diverse Elders Coalition is partnering with a wonderful organization that we're very pleased to be working with. Community Catalyst is the organization to advance education among diverse elders about how to engage effectively in the marketplace or in the exchanges, how to overcome some of the concerns and barriers and effectively participate and get enrolled for people who are not Medicare eligible. We're focusing those efforts in particular on 3 states, Georgia, Florida, and New Mexico, where there are large concentrations of members of our diverse elder communities that are represented in this coalition and where we believe we can have an important impact. And then our goal is to use the work of those states really as to be beneficial to diverse elder residents of those states, but also as laboratories to help us really figure out how to be as effective as possible in our support for diverse older adults, recognizing that obviously we're just in the first phase, the first year of enrollment. So our state-specific work falls into 3 general areas where we're supporting outreach and enrollment efforts in the 3 states I mentioned, and especially building the capacity of local partner organizations, local community organizations. These include affiliates of our Diverse Elder Coalition members and other organizations with whom we work. So building local capacity to reach older people of color and LGBT older people. We're also creating educational resources that are specifically targeted to older consumers themselves. And as Yanira indicated earlier, it's extremely important that those be culturally and linguistically competent and appropriate. And finally, we're producing policy resources for health and aging advocates about the specifics of the issues that face diverse elders to ensure that that navigators, for example, can effectively work with our populations. While we were emphasizing earlier the importance of community groups that have experience working within diverse elder communities, we're also realistic, and we recognize that in many cases members of our communities will be using navigators that are not within such organizations, and so we're trying to create the resources that those navigators need to be effective. And so we'll be working with through a combination of ultimately of training for consumers and advocates, social media outreach, and importantly, traditional education. We are working again with a population that in some cases does not have the easiest time accessing materials and information online. So we cannot forego traditional education like fact sheets and flyers.
Well, and Michael, we'll stick with you as we move to the next slide. That gets at some of the online strategies. Obviously, you need to have both resources available. And tell us a little bit about what you're doing on the online efforts.
Sure, absolutely. I mean, this is an effort that has to operate on, and move on parallel tracks, both online and otherwise. So with regard to our online work, we're very fortunate to have a blog site, diverseelders.org, that is a great portal both for diverse elder consumers and for advocates that are working with them. So that site has a health section focused on the Affordable Care Act, and we're regularly updating that with new information. We were very pleased recently. The Department of Health and Human Services requested an article from the Diverse Elders Coalition about how the marketplace matters to older people of color as part of their communities of color outreach. And so we're looking for those opportunities to cooperate and work online, with HHS around implementation. And, additionally, we're going to be producing a continuous stream of blog posts that explore key issues in more detail. So, for example, why the Affordable Care Act matters to older adults living with HIV. Information about the Affordable Care Act that's relevant to older immigrants, for example. And I also want to mention that in addition to the portals of the Diverse Elders Coalition, each of our member organizations has social media sites that are very important to our respective communities and that reach large numbers of consumers. I mean, Sage alone, for example, reaches more than 70,000 people monthly with its portals focused on LGBT older adults. And of course, the last thing I'll mention is that moving beyond our own portals, we'll be looking to pitch blog posts to media sites, especially media sites that target our respective diverse elder communities.
That's wonderful stuff. On our next slide, you talked before about linguistic competence and linguistic availability. Here's an example of materials in diverse languages. But tell us a little bit about that effort and also some of the challenges that you have in fulfilling that in different languages.
Yeah. So we're delighted to have been able to produce a brochure for advocates and older consumers on why the Affordable Care Act matters to diverse elders, and offering some simple steps on how to apply. And I think that resource has been very useful for our communities. We've also been able to translate those that material into several languages, into Spanish, Vietnamese, Chinese, and Korean. But we do know that one of our challenges is really fulfilling all the other languages and being able to do it in a way that is respectful to that language and to that culture, and resources are needed for that. So that is where we are right now. But we're optimistic that we will continue to produce effective materials that will get our communities closer to the Affordable Care Act and getting them accurate information.
That's great. And as we go to the next slide, the Department of Health and Human Services has recently acknowledged the great work that you folks are doing. Tell us a little bit about that.
Yeah. So the Diverse Elders Coalition and all of 5 of its member organizations have become part of the Champions for Coverage through the Department of Health and Human Services. And so the idea is for as a champion to help out and to assist populations and consumers understand the options they have and to understand the affordable coverage by sharing different resources and information available. So we're delighted that the Diverse Elders Coalition and its member organizations are part of that cohort. The National Hispanic Council on Aging, in addition to that, is also deploying navigators in South Florida, in Dade County, Florida, and also in Texas, in Dallas, Texas. So we are enrolling in the uninsured Hispanic population in those areas, in those 2 counties, and we are particularly focusing on members of this population who are socially isolated, who are monolingual in Spanish, and who would otherwise be left out by traditional mechanisms.
That's very, very important, obviously. Michael, let's turn to you on our next slide and talk a little bit about what other resources that you have from SAGE specifically towards the population you serve.
Sure, and just one thing to make sure with regard to the prior slide, to make sure that nobody would be confused. That $67 million that was awarded was for all navigators all across the country. We would wish that that level of resourcing was made available to diverse elder communities. So just want to make sure that wasn't a source for any confusion. But with regard to SAGE, as an organization, obviously our specific focus is LGBT older adults. And so we've created an online health insurance action center, which can be found at sageusa.org, that provides resources and information to help LGBT older people find out more about the plans being offered through the insurance plans being offered through the marketplace, and to help them choose and enroll in the best plan, again, for folks who are not Medicare eligible. In addition, SAGE is working to provide resources through our affiliates our SAGE affiliates in 19 states across the country. So, for example, in Colorado, we're working in partnership with the GLBT Center of Colorado and with AARP Colorado to encourage enrollment of LGBT individuals, including older adults. So through that project, there are a number of enrollment centers that have been set up specifically for members of the LGBT community, and it's been a very exciting and so far effective collaboration.
As we move towards the end of our presentation section today and move to the next slide, tell us about any other resources that are available online.
Yeah. So, with the National Hispanic Council on Aging, it's not online, but it's a telephone resource that is often very useful to older adults. So the National Hispanic Council on Aging has created a toll-free number that operates to answer questions in Spanish and English regarding the Affordable Care Act, and that number is 1-866-488-7379. CIRAC, the Southeast Action Resource Action Center, which is another one of our member organizations here at the Diverse Elders Coalition has also created a fact sheet series on their website, and you can find those at CERAC.org, and that they're providing information for undocumented immigrants and newly arrived refugees, as well as information in different languages such as Hmong and Vietnamese. So those are, in addition to what SAGE is already doing with the, Health Insurance Action Center, which I think is also very, very useful. The other organizations are doing complementary things.
And as we turn to our next to last slide, the Diverse Elders Coalition information is provided here, and tell us a little bit about what this site does.
Sure. So this is the Diverse Elders Coalition blog site, and it is the central hub for materials and information that are produced by the coalition. So it includes all of our reports and resources. For example, a report that we launched last year on economic security among and across diverse elder communities can be found here, along with a real wealth of blog posts from advocates and community members from across all of our communities on a range of topics, from health and wellness to access to culturally appropriate services at the local level, to the need to amend the Older Americans Act so that it represents the needs of our diverse elder communities. I'd highly encourage folks to visit this website and learn more about the wealth of resources that are available there.
Great. Our last slide provides the contact information for the Diverse Elders Coalition and our speakers. So if we move there, we will then move directly to your questions. Once again, you can write your questions in on the question box. It's on the right of your screen, and I'll be giving those to our speakers today. But let me start with our speakers then, and the first question really is about the role of philanthropy in this process. As you know, many of our members are local foundations and other charitable programs. And I think sometimes, particularly for the local folks, there's a sense that it's difficult to know how to be a part of these efforts on something like this, which is so large and is a national program. So could you give us some ideas about how local funders could be involved in some of these efforts? Michael, you want to start?
Yeah, I can start with that. I mean, in fact, this particular area of work, I think, is very conducive to the involvement of local funders because implementation is going on at the state and local level all across this country. And so, what I would encourage local funders to do is to you can reach out to either the coalition or any of our member organizations and learn about our local partners in your particular state and the work that they are doing around eliminating barriers to participation in the Affordable Care Act, barriers that diverse elders face. And we would be happy to tell you about work going on in your state and to connect you with those local efforts and local organizations, and would strongly encourage you to consider supporting them.
Anything to add to that?
Just to say that I think that with all the misinformation that we are seeing in some regions of the country, I think it's absolutely critical for philanthropy to step in. We need you. We need you in this process. And as Michael indicated, it's a huge task, and so the objective will be accomplished if all of us work together.
Right. One of the questions, and I'll try to phrase this a little bit, is that the issue of cultural and linguistic competence comes up a lot in this discussion. And we all, I think, recognize the importance of that, but also recognize that in many parts of the country and in many populations, the the number of trained professionals in all areas of healthcare is very small. So how do you see the balance between providing information and training to people of sort of all backgrounds who are working with diverse elders and trying to also provide folks who are really from the culture that you're trying to reach? I remember a specific example in New York where I think in Queens something like 50,000 Korean-speaking elderly and 2 Korean-speaking social workers. That was some time ago. Hopefully that's a better statistic these days. But, what do you do in a situation like that?
Yeah, I can get started with that question. I think, 2 things. One is the need for empowering patients is more important than ever today. The role that the individual will play in this updated system will change, and so to the extent that we can outline and provide tools for individuals to understand what their role is in the system, I think we will prepare better consumers for this updated healthcare system. So I think the idea of empowering communities, individuals, to be better consumers and to be more educated consumers is absolutely critical in today. The other thing is that wanted to just reflect a little bit on the fact that the Affordable Care Act allows us to emphasize the development of professionals to expand the number of professionals from diverse communities into nursing, into medicine. So the pipeline will be impacted and hopefully in the near future that the cohort of professionals in health and medicine will be stronger than it is today. But I think for now, empowering the patient and ensuring that he or she is effectively prepared to know what questions to ask when he or she goes to that medical encounter and understands what his or her rights are and what the expectation is for that patient today is more critical than ever.
And then I'll just add very quickly to that the flip side of patient empowerment is equipping providers with the information necessary to be able to respond effectively to those questions. And that's why I would go back and reiterate a point that we made earlier in the presentation, which is that the coalition and our member organizations recognize full well that it's very important that we operate on parallel tracks. We obviously highly value the importance and the role of trusted community groups and providers from the community itself. We also recognize that many, many members of our diverse elder communities will be seeking and receiving care and support from providers, from community organizations, from other kinds of entities that are not of the community. And so that's why the coalition has placed a high priority on creating materials, toolkits, guides, which any provider can use. Any provider and any entity can use to become better equipped to work effectively with diverse older adults.
I know that you also provide, this is an extension question, you also provide in general a great deal of training around cultural competence in general, not just on the ACA. So could you say a word about that,
Sure. And I think this idea, our philosophy is that cultural competency ought to be from both ends, both from the health professional as well as the patient. So that is the approach that we have been using, and we find that to be very effective. So working with we have an online course, for example, where we are helping health professionals be better equipped to serve a diverse population that is aging, who requires a different set of skills and attention. And at the same time, we're working with the older adults to help them understand what their role is in the healthcare setting. And I think that presents a more comfortable and a more effective visit with the medical doctors. And I invite you to visit our website, nhcoa.org, and look for this online training on cultural competency.
In the LGBT context, the LGBT aging cultural competency training and technical assistance is the exclusive focus of the National Resource Center on LGBT Aging, which is a partnership with SAGE and the Administration on Aging, and the products and services of the National Resource Center can be found via the SAGE website at sageusa.org.
So as we come towards the end of our presentation today, because I want to have an opportunity for you to leave your final thoughts with the audience, here's an interesting one. Do you think this is a short-term or a longer-term issue? Do you see this as being something that is going to need a great deal of focus for the next 6 months, and then after that it'll be kind of a maintenance issue like Medicare in general is, or how to apply for Medicaid? Or will this continue to be a major challenge both in the communities that you serve and others for a longer period of time?
Well, I can start with that. I mean, it would be nice if we could believe that this was a short-term challenge, but unfortunately, there's no reason to think that that is the case. I mean, the reality is that we know that both in LGBT older communities and in older communities of color, that we have serious challenges with an array of both health disparities and underinsurance and lack of insurance. And while we certainly think that the first phase of implementation of the Affordable Care Act, we're confident it's going to increase insurance coverage levels, we know that there's going to be a lot of work left to be done, both because of the patchiness and unevenness of implementation, and just because of the reality that, in fact, it is very hard to reach and access and integrate especially marginalized, especially vulnerable older adults. So this is going to be work that's done over years as opposed to over months.
That's great. Well, Yanira, let's start with you and ask you to give your final thoughts to our audience today about this important topic.
Well, I think just to piggyback on Michael's last point, I think that many of the individuals that we are in the process of enrolling are folks who haven't had a regular connection with the healthcare system, and by the time they will come into Medicare in a few years, their health status will be not in the best one, and so we are seeing that we are bringing in individuals into a healthcare system that are not in the best shape, and so I think the idea of helping them make the best out of their interactions with the healthcare system will continue to be an important piece, and so for that I think this is going to be a long-term commitment for all of us. Just to say that I invite you to visit the Diverse Elders Coalition website for more updates and new developments as the work continues. I once again want to say that this is a huge task that we are undertaking, and we can't do it alone, and we need you. We need you to be part of this effort in order to ensure that every older adult ages in dignity and in the best health possible.
Michael?
Yeah, I guess I would say in closing that this is, as Yanira said, it is a huge task. And at the same time, we really are, we perceive that we're at an inflection point where we're uniquely positioned to make a very important difference. We're tackling a very large problem of health disparities, health challenges, and lack of health insurance for diverse older adults. But we're tackling that large problem within an approach that we think, in a sense, has the best of both worlds. On the one hand, it is built around local efforts tied to local needs and local capacity, and those local efforts are occurring within the context of a coordinated national effort coordinated by the Diverse Elders Coalition and our national member organizations, and of course a coordinated effort by the federal government as well. So we believe that this combination of local focus, local projects with national coordination and strategy really provides an opportunity to seriously move the needle with implementation of the Affordable Care Act. And so we hope it's going to be a forum in which many funders can find a place for themselves.
As we close today, I want to thank Dr. Yanira Cruz, the President and CEO of the National Hispanic Council on Aging, and Michael Adams, the Executive Director of Services and Advocacy for LGBT Elders, or SAGE, for their participation and representing the Diverse Elders Coalition in today's program. We thank you for all your organizations do to make life better for America's older adults. I also want to thank the John A. Hartford Foundation and the California Wellness Foundation for their support of this program, as well as the American Society on Aging for their technical expertise. And finally, I want to thank all of you for participating in today's webinar. Have a great day.